We will continue about the personal protective equipment. Have ال PPE. ال PPE about the special cloth of equipment and employee protected against of infections material. الأوشا you have include الgown and surgical mask and الgoggles and the gloves and N95. N95. الgown is a purpose for protect your body. You have two types: isolation and sterilized gown. The isolation gown used for isolation, sterilized gown used for such as insert center line or for the OR. Considerations: selected the appropriate type or size, opening from the back, secure as the neck. Was it if the gown is too small or used to gown from sit in the front or gown to sit in the back. Technique: start from the neck and start from the neck, start from the gown. First wearing the gown, next mask and the goggles and the gloves. The last one, gloves. And how to removing gloves and goggles and face shields and gowns and mask and respiratory and washing your hand. Between the step, you should do hand hygiene and hand rub. Surgical mask. Surgical mask is purpose for protect your nose or mouth for exposure, secretion, and spray of blood or body fluid. Surgical mask should be part for standard precaution or droplet precautions. Place over how to using the mask. Place over nose, mouth of the chin, fit flexible nose space over nose bridge, secure on hand with a ties or elastic and adjust to fit. Technique for the donning. First, how wearing, start from the putting to up and make cell check for nose check is air is going out or not. Removing the mask from how you will remove from remove starting from putting, then the top tie or the band, and when you're removing is if contaminated, perform hand hygiene. Indication for a 95, where you will use a 95, use a 95 with an standard precaution air or precautions. Because when you want to go patient under airborne precaution, you should wearing a 95. Consider fit test must be done before using respiratory workplace. Achieve adequate seal face is essential. Conduct user seal check each the time usually is used. And select a fit test respiratory. Advice again put on respiratory under the wide disposal valve. Place your over nose and mouth and chin. Fit flexible nose bases over nose and portage. Secure your hand with elastic adjust and take your size. And how you do the seal check, perform user seal check. Inhaling, do respiratory inhaling should be collapse and exhale check for leakage around your face. First, put your 95 in your hands and put in front from your nose and cover your mouth and start putting this one in button under your ear, one under in your ear and another one up for your ear, and make cell check to make sure is air not coming out. Here, how to do a test. You have to test one from ensure notify is fit test for you by making the test, and another one Private test is use size for you 95, or choose your paper if you don't have size for 95. Doving, starting from putting a listing of your hand, then top of the listing and discard. If next you will do hand hygiene. الفيس شيلد شو الايز is position to cover your eyes, protect from any eye splash or coming from patients or from lab. الفيس شيلد you will cover your face, all your face, mouth, nose, uh, from an exposure or exposed infections. When you will extend the use for eye, when you is damaged, you will you will throw. Remember this one. You should discard your 95 by after is damage or visible sold or like this. The eye protection should be discarded if damage face shield can be longer first or visible sold. Leg gloves, you have three types: steroli and non-steroli and utility gloves. ال- utility gloves are used for handling contaminated with the housekeeping, and non-sterilite single use for this normal, usually not individual warping. About sterilite use for mostly used for surgery or disposable sterilite individual warp item. How to put the gloves is regarding to PPE. How to wearing gloves is the last one. Select your size and type, small or regular. Insert your hand into the glove, extending a glove over isolations gown. Keep the point for PPE before donning PPE. Use carefully. Don't separate contamination. Remove and discard carefully. Immediately perform for hand hygiene. Sequence going gown. If gown is not size for you, as not if gown is too small, you should use two gown, one front and another one in the back, and use mask or 95 goggles or face shield. Don't use together goggles, or this should be one. Here the structure for sequence for PPE doving. Now we will starting for transmission-based precautions. Transmission-based precaution. What is the transmission-based precaution? What is the difference between transmission-based precaution and standard precautions? Define difference type transmission-based precaution. What a type PPE are used? Need for each type. The standard precautions. First, for contact that can be transmission by contact, and this color code greens. And another card is about transports card. When you want to transport patient to another unit, you should put transport card to know this patient disease transferred by contact. Example, MRSA or hepatitis A. Wearing what is the standard isolation gown and the glove because it's contaminations. Isolation for droplet is the red, the same the red, and how the disease transmission by droplets. Influenza, example disease, sneeze or coughing, and you have transport to inform another departments. Do what is the standard for droplets? Surgical mask. About the airborne is blue using 95, But when you want to transfer patient, don't give patient a 95 only surgical mask from outside for negative pressure room or in airborne. Airborne isolation before enter the patient room. This is summarized table I put. You should all the room single room or put the same patient disease in the drop or contact. For airborne should be negative pressure. الكونتاكت cover contain by touch infection body because this by touching droplet give patients surgical mask when you transfer. What is the standard for contact? Is gloves, droplet, surgical mask, airborne 95. Needle stick injury. What is a needle? Needle happening, needle sharp container when you serious hazard healthcare associated. When you have broken needles, contact with contaminated needle, place, broken glass. When it happening during procedure, happening needle stick injury. Needle stick management immediately measure according to MOH. When you have needle stick injury, do not be panic. Stop immediately procedure performance, dispose properly that contaminated the gloves, dispose the sharp instrument in the sharp container, encourage your wound to bleed and holding under raining of the water, and clean your wound raining water, apply waterproof dressing in case of splash of the eyes, nose, or mouth, reagents of the clean of the water, identify this patient to look for diseases and take the culture for patient, maybe have hepatitis B, C, HIV, and immediate report. What is the reporting? Report, for example, according to the policy reporting, have dates, write the dates and the time on the students and job for classification, expose where and the place, locations, it can be where it is happening, and can be put mute. And procedure before expose staff and type use devices. Encourage control, include use safety syringe, and the last personal protective equipment. When you're happening for you, needle stick and you should be checking for HIV and hepatitis B and C, hemoglobin. HIV, full hour testing, testing minimum should be include HIV from 6 week, 12 week, 6 month. Starting from 6 week to until 6 month to checking for HIV, but about hepatitis, from 4 week to 6 week after exposure. What is when you are reporting within 24 hours, you should report about have needle stick injury. Spill management. The spill management, you have the diverse biohazard spill, urine, vomiting, chemical spill, and cytotoxic spill kits. Urine vomiting, the spill kit is not chlorine. We have biohazard spill we use for the blood and urine. You vomiting spill you will use for vomiting because can be a reaction with the gas when you use biohazard spill kit, and you have chemical spill kit. Urine is not chlorine based in is daily used to management this spill type because added chlorine produced to urine can be produced particle in placement or odor. So the step for the spill protocol control area to prevent all staff or patient or visitor to come here, come this area because you have spill kit. Notify both the PPE, personal protective equipment, gown, mask, face shield, gloves, and if there is any sharp, carefully throw in sharp container and start sprinkle disinfected granules over for leaving for 2 minutes to cover the blood and throw in the waste and diluted 7 tablets in 1 liter and collect absorbed by the spill. Use scooper and apply disinfected area for leave 2 minutes and remove the PPE and seal all plastic and last do hand hygiene. Here, if you have the blood spill less than 10, no need to use spill kit. But if you have large 10, you can use cover and do the 10 step. The last one about the popper. The popper, when you will use, the popper use it when not fitting for a fit test and you are half paired. You make surgery for your nose. You can use a 95 and not available your size. You will use the popper. The popper is include a tube, hood, machines. Use it. How to use it? Preparation by hand